National Doctors' Day is celebrated on July 1st all across India to honor the legendary physician and the second Chief Minister of West Bengal, Dr. Bidhan Chandra Roy. He was born on July 1st, 1882 and died on the same date in 1962, aged 80 years. Dr. Roy was honored with the country's highest civilian award, Bharat Ratna, on February 4, 1961.
The celebration of Doctors' Day is an attempt to emphasize on the value of doctors in our lives and to offer them our respects by commemorating one of their greatest representatives. India has shown remarkable improvements in the medical field, and July 1st pays a perfect tribute to all the doctors who have made relentless efforts towards achieving this goal, irrespective of the odds. Dr. Bidhan Chandra Roy made quality health services available to common people. He established some leading medical institutions in Calcutta, like the R.J. Kar Medical College, the Jadavpur TB Hospital, Chittaranjan Seva Sadan, Kamala Nehru Hospital, Victoria Institution, and Chittaranjan Cancer Hospital. He played a key role in establishing the Indian Institute of Mental Health, the Infectious Disease Hospital, and the first ever postgraduate medical college in Calcutta. In 1925, he tabled a resolution to study the causes, effects, and prevention of pollution in Hooghly. As mayor of Calcutta Corporation, he promoted free education, free medical aid, better roads, improved lighting, and water supply. Audiologists specialize in ear-related issues, particularly with regard to hearing loss in children. These doctors work with deaf and mute children to assist in their learning to communicate. Audiologists typically work in hospitals, physicians' offices, audiology clinics, and occasionally in schools. Allergists. Allergists work with a wide variety of patients who suffer from issues related to allergies such as hay, fever, or asthma. They are specially trained to treat these issues and assist patients in dealing with them and what to do when they encounter. Anesthesiologists. They study the effects and reactions to anesthetic medicines and administer them to a variety of patients with pain-killing needs. They assess illnesses that require this type of treatment and the dosage is appropriate for each specific situation. Cardiologists specify in the study and treatment of the heart and the many diseases and issues related to it. They assess the medical and family history of patients to determine potential risks for certain cardiovascular diseases and take action to prevent them. Dentists work with the human mouth, examining teeth and gum health, and preventing and detecting various different issues such as cavities and bleeding gums. Typically, patients are advised to go to the dentist twice a year in order to maintain tooth health. Dermatologists study skin and the structures, functions and diseases related to it. They examine patients to check for such risk factors as basal cell carcinoma and molds that may eventually cause skin disease if not treated in time. Endocrinologists specify in illnesses and issues related to the endocrine system and its glands. They study hormone levels in this area to determine and predict whether or not a patient will encounter an endocrine system issue in the future. Epidemiologists search for potential diseases that may crop up and cause a great deal of problems for a population and look for vaccinations for current terminal diseases such as cancer and HIV. Gynecologists work with the female reproductive system to assess and prevent issues that could potentially cause fertility problems. Female patients are typically advised to see a gynecologist once a year. Gynecological work also focuses on issues related to prenatal care and options for expectant and new mothers. Immunologists study the immune system in a variety of organisms, including humans. They determine the weaknesses related to this system and what can be done to override these weaknesses. Neurologists work with the human brain to determine causes and treatments for such serious illnesses as Alzheimer's, Parkinson's, dementia, and many others. In addition to research on the brainstem, neurologists also study the nervous system and diseases that affect that region. Neurosurgeons operate on the human brain and body to treat and cure diseases affecting the nervous system and brainstem. They work to alleviate symptoms from serious brain illnesses that cause patients a great deal of physical and emotional pain.